Hi, I'm Miriam Evans. I'm one of the pelvic health physios in Powys, and this video is to help anyone that is postnatal, cesarean section or vaginal delivery to get back to optimal recovery. During the first few weeks and months, postnatal exercises are probably the last thing that's on your mind, but actually looking after yourself and exercising can be really, really good for getting you back strong for the long term for looking after your baby. So to start with, we're looking at pelvic floor exercises. You may have been doing your pelvic floor exercises through pregnancy, you may not have done. Pelvic floor exercises are really important, whether you've had a cesarean section or a vaginal delivery. If you've had a vaginal delivery and you've got damage to the pelvic floor, you may have had stitches or even just a graze or nothing at all, then just doing a pelvic floor exercises again, we need to get the pelvic floor working. It's just stretched to allow a baby to go through it, so often it gets switched off. If you've had a cesarean section, you might think, well, I don't need to do my pelvic floor exercises because I didn't damage my pelvic floor, but we do know that the abdominal muscles and the glute muscles work together with the pelvic floor, so if one of those is damaged, it can inhibit the other one from working. So I've done a video on how to do pelvic floor exercises, so after you've watched this through, if you go to that video, it'll show you how to do them effectively. There are ways of doing your pelvic floors in different positions to make sure you get the whole of the muscle parts working and not just the back part or just the front part. If you've got a lot of swelling, it's worth using ice. You can buy ice packs from a pharmacy that are perineal ice packs, or you can make your own out of a bag of peas. And you're looking at sitting on an ice pack for 10 minutes up to 3 times a day, no more than that, and making sure you don't get perineal burning, so make sure you've got some layers between the ice and your skin. Ice is just great for reducing swelling and inflammation, but pelvic floor exercises are also really good straight away from day one for increasing the blood flow to help with recovery, to help with the stitches and reducing scar tissue there, but also to aid blood flow to the area. So you might find that if you've had a cut or a tear through your nerves that actually don't have too much pain and it feels, you think, oh, this is great, but actually if it was a bad tear, you might find the pain starts to come on later, 2 or 3 weeks time, as the nerves start to regrow and start tingling and getting more sensation, but then hopefully they start to ease off again as they carry on healing. At 6 weeks, it might be worth, if you've had a tear, to have a look with a mirror and see if you can find the tear, have a feel of it, and you can do some perineal massage on that tear to loosen that scar tissue using olive oil, and you can just do very gentle, either just touching it gently just to get used to the sensation of touch, or you can go a little bit deeper depending on how it feels. Just take your time. If it's really, really sensitive and really, really painful, then leave it for a couple more weeks until it starts to feel a bit easier. And if that's not the case and it's still staying painful, then seek a referral to see a physiotherapist about it. So if you've had a cesarean section, you will need to activate your lower abdominals to switch them back on again. So often an operation through the tummy muscles will switch off your muscles. But also, having had a baby, stretching your tummy muscles for the last few months is going to switch off your tummy muscles as well. So doing some exercises to start those muscles switching back on again is crucial right from the beginning. If they don't switch on, what tends to happen is these muscles overtake and switch on to compensate, which you don't notice because you might have been doing it a long time before you were even pregnant, overusing these muscles. But if these are overworked for long term, then it can cause a bearing down effect that will can cause prolapse. But also, as you squeeze these muscles in, like effectively sucking in your tummy muscles, your belly button rises up. And if your belly button's rising up and these are sucking in, you're causing a bearing down effect, but also your bladder is attached to your belly button by a ligament. You're pulling the front of the bladder up, and that's pushing down the back of the bladder, and that can cause more of an urgency to run to the toilet. So getting these muscles firing at the bottom is really important straight away. So if you've just had a cesarean and thinking, well, how am I going to exercise straight away? You can just try lying in your bed and squeezing your lower tummy muscles in and then letting them go. So you can see my upper tummy muscles are not moving, and then it's just a contraction just below your belt line. So rather than thinking suck your tummy in, just think tighten your tummy, think about taking your belly button towards your pubic bone. So you're feeling just inside your hip bones, a contraction in there. You can do it when you're sitting, you can do that when you're lying in bed, and you can, if you've just had your cesarean section, try looking at my postnatal exercises video, core exercises video, sorry, and have a go at the first couple of exercises. So that's your activation of that transverse abdominal muscle. You can do some pelvic tilting, and you can do some knee rolling, and then as the weeks go on, you can try doing some knee lifts, and you can progress onto your exercises. For anyone else who's had a vaginal delivery and you know that you've not had a diastasis, which I'll talk about in a moment, you can have a go at those core exercises, and you can do all those core exercises on my core exercises video. If you've had a diastasis, which is where the tummy muscles stretch so much in those later stages of pregnancy that the connective tissue that holds your tummy muscles apart starts to pull apart. That's normal because the hormone's relaxing. I'll just show you how it works by standing up. So as the pregnancy progresses, the relaxin hormone helps your connective tissue to give so that your bump can grow as it comes out, and it just keeps giving. Then if you've got a particularly big baby, exceptionally big baby, then those muscles might go very thin, the connective tissue, and for some people it totally rips. And that can leave a gap in the stomach muscles. So it's really worth checking your tummy muscles. Everyone check their tummy muscles after you've had your baby. So if you lie on your back with your knees bent, and then with your tummy really relaxed, you just pop your fingers just below your belly button and relax them, and they'll just sink into the tummy muscles. Then while you're lying on your back with your tummy muscles relaxed, with your knees bent, just bring your head up. And you'll feel that either your tummy muscles will pull together and push your fingers out the way, or your tummy muscles will pull together around your fingers, and you'll feel your tummy muscles on either side. And that's fine. If you can fit 2 fingers in, absolutely fine. If you're not feeling your tummy muscles squeeze, and you put a 3rd finger in, and then you can feel your tummy muscles squeeze either side, or 4 fingers, then that you've probably got a slightly enlarged gap, rectus diastasis. Test again in a few days' time, and if it's still not 2 fingers, then and it's in a week or 2, it's staying wide, then look to getting a referral physio, or just have a go at the core exercises that on my core exercises video, gradually strengthening up. And if you're reaching a plateau, you're not getting any more improvement, then come and see us then. So in terms of your core exercises, a really good way to make sure that you're getting the right muscles working on an everyday point of view without even doing your core exercises is to think about your posture. So by getting the correct posture, you engage the right muscles. So if I just show you the different postures, if you're standing with your bottom out a lot or letting your tummy go, then you're not engaging your core muscles. Just tuck your tailbone under until you've got a flat pelvis at the front, and your tailbone's tucked under. You'll feel your glutes, your bum muscles are slightly activated. Your tummy will activate naturally doing that position, and your pelvic floor can work optimally. I'm not saying squeeze it so tight that you can't walk. It's not healthy to hold your tummy muscles in all the time, okay? It's just thinking about your posture, and if you get your pelvis into the nice neutral posture, you'll automatically activate your glutes, and you'll automatically activate your lower abdominals. Then you want to think about functional stuff. So if you can get into that posture, then whenever you lift your baby, you'll be using your lower abdominals, you're not going to be using your back muscles. So posterior pelvic tilt into neutral, lift up your kettle, do your hoovering, moving your pots and pans, or whatever it is that you're doing around the house, or pushing a pram. Then if you can get your pelvis neutral, you're using your lower abdominals. So that's just a little bit about posture and how that can affect. And if you have a go at the core exercises, then you'll be strengthening extra as well. They only take about 5 or 10 minutes a day, and you could do them once or twice a day if you can find that time. So while your tummy muscles are feeling loose, don't stress about them staying loose for a while. It does take a while for everything to shrink back down again, for the uterus to shrink up, for the tummy muscles to come back together. While they are feeling loose, you might find it easier to get out of bed by log rolling onto your side, so that you're not straining by leaning forward and straining those muscles. If your perineum is very painful when you're sitting on it, try lying in bed for a few days getting up to do a bit of pottering and then going back to a lying position. So you're taking the weight off it and allowing the blood to flow to the area. Lying on your back with a couple of pillows under your knees is a nice way to offload the perineum, or lying on your side with a pillow between your knees, again, can offload it. So in terms of going back to exercise, returning to exercise, this will completely depend on how much exercise you did before you were pregnant, how much you did in your pregnancy, so how fit you were before. It'll also depend on what kind of labour you've had and what sort of birth experience you had, whether you had a lot of trauma, whether you had a cesarean section, or whether everything went much more straightforward. It'll depend on the size of the baby. So don't go comparing yourself to other people, and I don't make it a race to get back to fitness as quick as you can. Just go slow and steady, and be mindful of your body. If doing exercise hurts, then you're probably doing it too soon, doing too much too soon. So a great way to start off is with walking. You can get out and do short walks. You want to start walking as soon as you can, particularly after you've had a cesarean, to avoid getting scar tissue. You can just get out of bed on day one, have a little walk to the toilet and back, and then gradually increase your distance as you feel okay. But you will feel exhausted. So even if you're not feeling pain in the abdominals, you might find that you're totally wiped out from a 5-10 minute walk and you have to sleep lots. That's really normal. So please don't worry. You've had a major operation underneath that scar. So swimming, we say 7 days or when you've stopped bleeding. So the bleeding can continue for quite a few weeks after you've had your baby. So once you stop bleeding, 7 days, you can go back to swimming. Or if you've had a cesarean section, I would probably wait for 6 weeks. You could ask your GP if it's okay to check, but the same principle works with bleeding for 7 days. No bleeding for 7 days with the swimming. We also recommend that you don't go back to running for at least 3 months. So the ligaments in the pelvis take at least 3 to 6 months to return to normal. And for a lot of people, it can take up to a year to return to normal. So to start doing heavy impact exercises before they've returned can really affect your pelvis and cause longer term problems. So don't race back to running. You can do fast walking, walking with your pram. Remember your posture, tailbone tucked under. Fast walking is a great way of increasing your abdominal tone by because you have to activate your pelvis to walk a bit faster. And Pilates and yoga exercises, but simple. Start with simple. Try not to do double leg lifts. Try not to do full sit-ups. Have a look at my core exercises video and progress slowly from there. If you've got a local group that do Pilates and core exercises, then ask them to check that you're doing them correctly. Ask them to check that you're using the right muscles, the instructor that is. Exercise is going to depend on who you are and should be pain free. If you go back to doing too much too soon, then it can actually just cause prolapse and bladder problems by you using the wrong muscles and then bearing down. So if by 6 weeks you're feeling symptoms of incontinence or prolapse, or any problems doing your pelvic floor still, or you're still getting a lot of pain in your perineum that's increasing or just not going anywhere, then either chat to your GP to get a referral, or in some counties you can get self-referral, download a self-referral, and come and see a pelvic physiotherapist. And lastly, I just want to talk about opening your bowels and constipation. So constipation is really common in pregnancy. A lot of people say that it gets worse once they've had their baby, and if you're breastfeeding particularly. So a lot of that's dehydration because you're producing so much milk, but also the hormones in your body can cause constipation too. So just being really mindful of drinking plenty, and eating plenty of fibre and fruit and veg to keep stools soft. And if they're still not soft, you might need to take some laxatives. In terms of the opening your bowels, it's really important to think about the posture that you sit in. So sitting on the toilet, bending over, you're leaning forward. See if I can show you here. So you want your knees elevated if you can. So if you can get a stool underneath your feet to lift your knees up, and then elbows on your knees, so you're leaning forward. And then while you've got your elbows on your knees, you want your tummy to be completely relaxed and let go. So doing some breathing exercises in that posture. So knees up, elbows forward, and then breathe through the whole process of going through a poo. If you're holding your breath, you're straining. We don't want any straining to happen. If you've had stitches to the vagina, you'll probably need to get some toilet tissue and push them against the stitches to support your perineum while you're opening your bowels. And if you had hemorrhoids, which are really common during labour, then your midwife should be able to give you some Anusol cream. And if that's not doing anything, it doesn't feel strong enough, then you can get prescription cream from your GP that's even stronger. So don't suffer with it, because the hemorrhoids can be even more painful than a tear in the vagina. And then last little bit is returning to sex. So for a lot of people, they don't even want to think about it. It's not in their mind. You're tired. Your hormones are such that you're probably not even thinking about wanting it. But what we would advise is that if you've had a tear, that you wait at least 6 weeks before a bad tear, a third degree tear particularly, that you wait for 6 weeks before you resume sex. But if you're thinking about it, for you to have confidence, it's worth you getting a mirror, having a look, having a feel. Do some self-perineal massage just to make sure you're happy with your body, and it'll just give you a lot more confidence. If you're breastfeeding, you probably will need to use a bit more lubricant, and it's worth using lubricant anyway, just for your confidence, so that you're not causing any pain. The first time might be a little bit painful, but it will ease up. So if you can try and relax as much as possible, it'll help you. And remember that while the cervix is fairly low, it might feel a little bit tender or deep penetration, but that should ease up as the cervix rises up, as full recovery happens. But if you've got persistent pain on intercourse, that's not normal. So that's when you should really contact your GP. In conclusion, if you're worried about incontinence or prolapse or pain, or any problems with your bowels, then please contact your GP or contact your physiotherapist. You're welcome to message me, and we'll try our best to get you better. But try and make sure you've watched my pelvic floor exercises video and my core exercises video, and see if you can take some time out to have a go at those, even if you have someone else to look after the baby for a little bit, for you to be able to do that and have time for yourself. Pamper yourself, go for a massage, have some time out to go for a walk, what makes you feel happy, just to get out and about. All right.